Welcome to our final webinar for the PMP Quality Improvement Project. And this one is a wrap up on all things sustainability. So we can take the lessons and improvements that we've gained, hold on to those, and reliably maintain them. So we've improved, and now we need to figure out what we're going to do next. So let's take a moment to reflect on your progress throughout this quality improvement initiative, looking back through your documents and KEDA, the modules, and the data cycles that you've completed, and compare that relative to where you started and against the key driver diagram and the specific aims that guided your improvement work. What interventions and changes did you embrace and adapt to your unique clinical setting, the providers that you worked with, and the patients that you cared for? And thinking about the changes you've tested, the improvements that you've made, pull most of your data together, especially that recent data cycle, and reflect on it. How much of a gap have you closed from where you were at baseline to the goals stated in the key driver diagram? Did you achieve your goal? Did you achieve the collective goal for the quality improvement project? If not, how close are you to doing so? What additional items can you test that will work to either continue closing the gap and rely on the theoretical framework that guided your efforts throughout this process, the model for improvement, to continue honing your vision, developing changes, and measure the effect of their impact? So with the project ending, we want to figure out what's going to happen next. Back in our PDSA Cycle webinar, we spoke about testing and how we can learn about what works on a very small scale within your unique clinical context and culture, and performing tests over a wide range of conditions. And then once we figured out how to adapt best practices and evidence-based messages to your unique nature of your clinical setting, working to implement those after a series of tests so that they become a part of your day-to-day operations. We're at that final step now. If you haven't already implemented and had stable processes, that's where we're moving towards. And sustainability is taking the work that you've done in that green bucket, the improvement work, those continuous tests of change that build upon each other, incremental learning, and shifting it up to the sustainability bucket so that now you are embedding those in your everyday work, especially if you haven't done that already. Sustainability has several definitions. It is the endurance of systems and processes. It is locking in the progress that hospitals or clinical settings have already made and continually building upon that. And then it's looking at new ways of working with improved outcomes to make them the norm. In other words, it is when an improvement has become an integrated portion and mainstream way of doing work. It withstands challenges and variation over time through a process of continuous improvement. And it's this last one that is highlighted in blue that I hope is the way that you can perceive sustainability, having done this project and now working to approach sustainable components within your practice. So sustainability happens as we look at a variety of mechanisms that are in place to support that. We've done this quality improvement project. We put the data systems at your fingertips. You received credit for participating and completing components of the project that we've asked of you. And it's been basically provided in a package for you to complete. Now that that package has kind of wrapped up, what can you do moving forward when you have to develop the framework or think about the data or maybe even gather funding? So some things to consider as you're trying to figure out how to carry this forward. Think about funding. If there's additional funding that you can secure to get resources for patients, for printing paperwork, for having incentives for families to come back when they're setting goals or to award good behavior. Looking at your personnel, how can you continuously train them, especially if you have a lot of staff turnover? And that's where that office flow diagram comes into play, so that you can train, if it's necessary, and retrain individuals when they come in, and keep everyone up on standard operation of the procedures that you've done. Shifting in roles and responsibilities, moving from it may have just been a job for this project, but now this is something that we're doing because we've seen how it's impacted our patients, we've seen how it's impacted your interactions as a provider, and now it's something that we're doing and creating a culture for healthy diet and activity. Having buy-in and support and that leadership engagement. If you can recall back to the start of this initiative, we spoke about having your core quality improvement team and even mentioning this project to leadership or senior leaders, so that they could understand what you're working on and be there at the beginning. So when they see the changes that you've made, you can have their buy-in from the start, and they can support you as you bridge from an improvement program to sustaining and holding gains and impacting patients. It's helpful to continue your regular team meetings so that you can huddle, have conversations about what's happening, feedback of data. And then systematic structures, embedding in training so that you can keep up to date and abreast on new information that's coming up around diet and activity. Memory aids, so if you are not necessarily remembering to always do blood pressures on your 3-year-olds, or categorize or set goals with families, or reflect back on previously set goals, you have some sort of memory aid in place to make sure that you can keep doing and carry forward the good work that you've done. And then finally, through this and the practice coaching model, we've been able to aid in your evaluation and give you feedback on how things are going. And if your data started to fall or you had issues, we're able to catch and redirect you in a timely fashion. That's something that you will be working on yourself now. So what type of data mechanism will you have in place to make sure that you're still doing what you did during the course of the PMP Quality Improvement Project? How will you redirect if something should shift downward and not head in the direction that you've been going the past couple months? And that may be publicly displaying and sharing information and having your own run charts formulated so that you can show everyone how things are going. And if something is not heading in the right direction, having a conversation at those team meetings and with your personnel to redirect and get back in the right direction. As we began this project, we discussed the importance of carefully considering and constructing your core quality improvement team to carry on, learn, and promote this effort. Leadership was essential to this process, not only in guiding the team effort, but securing senior leadership. We then discussed how the engagement of team members by understanding where individuals were coming from at an emotional, behavioral, and cognitive level let them know the importance of this endeavor and the impact that it would have at them being involved and a part of this team. Team members were encouraged to be empowered, to have their voice heard, to feel listened to and involved in this process from the start, that what they said and what they did was truly valued, heard, and was impactful to the work that you were doing. Measurement was critical for helping us understand not only the impact of a PDSA cycle or a change effort, but whether it actually resulted in improvement. Real-time data helped drive this learning process through the run charts that we provided in the KEDA environment. And in approaching this initiative, you learned how to be innovative in your thinking and approach to change. The key driver diagram provided a starting point for you to adapt ideas to a better way of doing things for you and your providers and your patients in your clinical setting. But then you were able to think outside of the box and identify how you could adapt things to this environment. Your work was evaluated and its degree of improvement by seeking to determine if your objectives and aims were achieved, focusing in on why certain items worked or didn't work, tweaking your approach and moving forward to realize your short and intermediate outcomes. And then we had some human factors. The final 3 factors of sustainability will be addressed throughout this presentation as you work to reach your goals if you haven't already, how to plan for maintaining this level of improvement, and spreading your effort in a reliable manner. I've mentioned the sustainability factor of culture several times throughout the series of webinars I presented and on our coaching calls, but it's really understanding the role of culture on how people behave and their ability to deliver improvements. It's the way we do things around here and has 3 levels that we can experience things. Artifacts are the things we see, values or the things we say, things that we think and feel and what they're really like drive us, and those are our beliefs. And there are different things that influence how we have an attitude towards things and what we value, and these can be adjusted in a positive direction. The layers of culture that host additional levels of attitudes and values, the locale in which our clinical setting is housed, the specific place of work and your particular professional group to which you belong to all have values and attitudes that help shape your clinical culture. Understanding and acknowledging these levels and layers will have you identify any barriers to continuing or maintaining your improvement effort, as well as characterize facilitators. The next one are knowledge into action, and how we can use this one for a key for success is accessibility and use of any resources and knowledge. To improve is to change, and to be perfect is to change often. So while this improvement period is over, the learning process does not have to end, and to continue staying at the forefront and on the cutting edge, you must continually conduct unofficial tests of change and transform that into knowledge that is accessible to all within your core quality improvement team and your sustainability team, and even further than that into your practice. This knowledge may be in the form of skills or insight and relationships as new information is acquired. Sharing and dissemination of what has been learned, especially during the spread efforts, and finally integrating that learning process into the practice for it to be utilized are all key things. During your sustainability and spread efforts, hone your vision and clearly define what you hope to accomplish in an aim that outlines how people are going to go about applying the knowledge at the forefront. Take the research that you've done over the past couple months and the lessons that you've learned, gather those who will be involved moving forward, and the location of impact so that you can compile all of this and move it forward. Our final factor is how we can manage change. And the key for success here is that people are supported to understand the problem a change is trying to fix and are actually involved in designing and testing solutions to fix that problem. There are technical and social changes. Technical changes are really specific to the nature of the change, and social are how people feel about the changes that are being made. While it is important to pay attention to the particulars of the change effort, you should focus on the people involved in order to support, drive, and sustain the changes that are being made. Things like psychology and emotions behind the change that you're working on are very essential to this process. And as your new change or current changes are being tested, and as you're working to sustain the change or spread it by getting more people on board, 4 items may prove useful in these efforts, and those are listed here on the screen. Tell a good story. Get people engaged by seeing the purpose of the work that you've done with PMP. Tell them a story that you've experienced or a patient that you've impacted, and help secure some buy-in to help them work on this initiative as well. Having senior leadership, or at a minimum a champion, model the behavior or change is one way to build self-efficacy of those working on this. Looking at reinforcing mechanisms, you fine-tuned how to do this initiative in your unique clinical setting with your patient population. Now make sure that the system and processes to accomplish this align with the behaviors that you wish others should be doing to have the same outcomes that you experienced. And then the final one is training, training, training. bite-sized pieces or comprehensive. Either of those ways ensure that your staff has the appropriate skill set, competencies, and confidence to do what you're suggesting. You're building capacity in the individuals that are involved. As you consider this element for sustainability, think about what technical and social elements need to be considered. If someone is resisting, why is that? And is there something that you could do differently to address the concerns of those that are resisting change? So now, are you ready? Should you sustain or not sustain, but actually work on spreading? So there are 3 things that you can ask yourself. Have you met and or exceeded the goals and benchmarks of this project? Are you doing so in a reliable and consistent fashion without a whole lot of variation? And with all those people that are working on this, are they using the same processes? Is it standardized? To plan your next steps, if you have all 3 of those previous questions on the slide answered as yes, now we can work on our sustainability plan. And we'll be working through this a little more concretely with you in person, but this is just to give you an idea of how to shape that plan. Just like we did an evaluation plan in the PDSA Cycle webinar, where we thought about what resources we have at our fingertips, what activities can we do, and how will these impact short, medium, and long-term goals and outcomes. Think about that in the term of, this is of course your long-term context, but think about it in terms of how can you lay out a plan for spreading the work that you've done, holding the gains and improvements that you've made, and getting this out into the rest of your practice and nursing staff and so on and so forth. So confirm what we just said on the last slide. Identify what you expect to be the results and how frequently you may collect data and review. You want to have some sort of spot check in place to make sure that you're getting what you expect. Just like we had you submit data, although it may be less frequently than what we did in this initiative, having some sort of review of data and its presentation on run charts or some sort of frequency to know if you're meeting the goals that you've set. Look at identifying positions that are accountable for each step and roles in the process. So that goes back to our office flow map. You've mapped out what your current process looked like. We did some test of change. Now might be a good time to update that office flow map with the lessons that you've learned and some of the standardized procedures that you've put into place and have implemented. And use that as another working document as you work to spread and sustain this so that people know what their roles and responsibilities are and specific steps that you expect to occur around diet and activity and goal setting. Outline these actions and a plan for deviation. This is your catch and redirect. So you have your data in place, you have an office flow map that lets you know what should be occurring by who and when, but what happens if something veers off course? How are you going to redirect? Then think about that capacity building. Determine ongoing training and competency requirements. Things may be well as you come off of this project where everyone has had some refreshers or updates in knowledge or new lessons learned in terms of diet and activity, motivational interviewing, food security, but how can you keep that information fresh and current outside of this? Look for other opportunities to improve your knowledge and keep current on information around diet and activity and obesity prevention. And then seek to embed the sustainability factors. Reflect on those that were listed in that pyramid in the earlier parts of this webinar and think about where you may be lacking. Do you not empower individuals or engage them at appropriate points? That may be a good thing to tackle now. How can you empower and engage your staff in their daily work and have a sense of ownership? It may be looking at your change management. Any of those 10 factors are something that you could explore and work to strengthen to make sure any other improvement effort outside of PMP can be sustained as well. So then it's a very similar process from there in terms of next steps. Just like we started this improvement period, you can start the sustainability period, and that's by looking to your team. You may certainly keep the new team or add to it, represented not but by just a small interested group that was involved in the initial activities, but maybe everyone in the clinic or everyone on the nursing staff. Bring more to the team, bring them up to date on what has occurred, and give them a game plan about what is going to be happening. And very similarly, we set an aim for our improvement efforts, set an aim for what you hope to accomplish over this sustainability phase. And then measure. We had measure sets that dictated how we knew changes that we were making were resulting in improvement. Similarly, you'll have measures in place to make sure that you're staying at the level of improvement that you would like to stay at, and regularly review those with your team to ensure that your goals are being met and maintained. This all goes back to that elements of an essential improvement team. Similarly, elements of a sustainability team. That team leader who's going to really drive the effort, clinical and technical expertise. It may be important now to look at that more technical side of things on how you can further improve your electronic medical record to support all the information that you've acquired over the past months with PMP. And day-to-day leadership and elevating that, especially now, to the senior leadership and how you can have those individuals involved and promote this project. And then if you feel that you have sustained and now you're looking to spread, when best practice is disseminated consistently and reliably across a whole system and involves the implementation of proven interventions and applicable care is one way to define spread. And then the Institute for Healthcare Improvement defines it as actively disseminating best practice and knowledge about every intervention and implementing each intervention in every available care setting. When you're looking to spread your improvements, think about how you can lay the appropriate foundation. Have your clear, concise message, a team and a leader who will share successful results of your work within this specific quality improvement project, and then develop an initial plan. Again, we have an aim that helps guide what you intend to spread, just the best practices that you've learned or how you achieve those best practices, and then how they can adapt those best practices to their unique clinical settings or how they work as a clinical provider. Thinking SMART, of course, we always come back to those SMART goals of things being specific, having associated measures and actions on how we can achieve this, done in a relevant and realistic manner, and having it done and completed by a certain time frame. And then always working to refine things. Learn your lessons, spread and adapt and continuously improve, work out the fine tuning and move things forward. So the final slide is our action slide and how we can determine next steps. To think about if you are ready. Do you need to continue your improvement efforts because you haven't gotten quite as far as you hoped or as close to the goal as you had hoped? Do you need to establish and fine-tune sustainable systems and processes and supports to maintain the improvements and the gains that you've made? Or are you at a step where you've done those previous two items and you're looking to spread it outside of your clinical environment and providers that you work closely with, more institutional based? Create and foster an engaged and empowered team. Teamwork is so essential here, and I mentioned at the beginning of this whole initiative that having a team makes someone more successful in having PMP embedded, reaching program aims, and impacting patients. So go back to your team, host another team meeting, communicate the purposes of what you're trying to accomplish as we transition from the improvement to sustainability period. Highlight everything that people have done over the course of the past months, their specific skills, and keep those in mind for upcoming sustainability and spread activities. And then discuss time commitments. Improvement may take a bit more time to get things up and running, but now it should be standardized and efficient, and it should be efficacious. So let's talk about how our shift in commitments may occur as we move from improvement to sustainability, and what your level of involvement from staff will be now and their effect on current workloads given this transition period. And then, of course, outline your plan. Just like we did with that evaluation plan, how can you approach this with the resources that you have, activities you need to do, and the goals that you would like to occur short, medium, and long term? We'll be discussing this in more depth at our final practice coaching call and as we wrap things up for this initiative. So have these items ready and we'll hit the ground running.